Since its inception in 2008, Siltec has provided young individuals with over 1.7 million jobs through its large network of programs spanning 17 countries. Transitioning into 2021, we endeavor to expand our outreach and circumvent the challenges that were brought about by the present pandemic, and shall continue to pursue our goal of creating over 5 million jobs by the end of 2022. I am pleased to be joined today by our distinguished panelists, Mr. Jim Campbell, the Director of the Health Workforce Department at the World Health Organization, and Ms. Fatma Al-Ahbabi, Acting Head of the African and Asian Projects Department at Qatar Fund for Development. Thank you both for joining us at the World Innovation Summit for Health for what promises to be a very insightful exchange of dialogues, ideas, motivated solutions that are intended to alleviate the harsh realities and devastating socioeconomic consequences of COVID-19 on youth and women. Thank you both for being here and joining us.
Thank you, Benar. Thank you so much.
Thank you very much.
Good afternoon. All right, so this will be a discussion, and at the end of it, there will be a Q&A where we will be taking a few questions from the audience. Now, let me start with Jim. How do you think we can work towards not only managing the pandemic, but managing its aftermath on youth and women that are expected to last long beyond the pandemic itself? And how do we ensure that the exponential increase in demand for more jobs in the health sector is met?
Thank you, Benar. Well, that's a nice, easy question to start with. You're asking several things there in one. I think that clearly the impact on women and youth, the demography as a whole, that we're starting to see. Then perhaps there's an issue there about, women and youth who work in the health sector. So not just as members of the population, but exposed in the health economy today. And then some issues around how we come into the future. Let me see if I can just try and give you some initial thoughts on that.
Yes.
Clearly, around the world, we're seeing a huge and disproportionate impact on women and youth in multiple different ways. The postponement of education from months to months to months, whether that was high school education or university education, so disproportionately impacting youth and their learning, and this education crisis that we've been hearing about. And indeed, there's been a white paper launched just recently from the education sector on how to save our future, and some very concerning facts worldwide, this huge disruption to education. But schools also offer other elements for youth. They offer health literacy, health promotion, water and sanitation. Some schools offer nutrition, and school meal programs to ensure that youth and children are engaged and are eating, and we're not having food hunger and food poverty coming through. And then this huge disproportionate impact on women in our societies who are in many settings, the carer of the family, the carer of the children. We saw, for instance, studies coming out of Europe, women who are nurses having to take time off their work to look after their role as children because, men are not pulling their weight on this issue. So there's some real disproportionate impact in society as a whole. Let's look at the health sector, the next layer down. We've published just last year in 2019 two very good evidence reviews around the demography in the health and care workforce. One on youth. And we're seeing in the last decade this exponential increase in the percentage of youth employed in the health and care sector. Around the world, more and more youth coming into the profession under the age of 30, under the age of 35. And women make up around the world almost 70% of our health and care workers. And in some occupations, we published this year the State of the World's Nursing Report. In nursing and midwifery, 90% of the occupation are women. So they're in a role which is now being tasked with managing the pandemic, maintaining the delivery of all other healthcare services. And we've seen the huge disruption to healthcare services this year around the world, high income, middle income, low income contexts, all having similar challenges, some more than others, coming through. So both women and youth are in that environment. And therefore, in that stressful role, potentially where they are being challenged with high risk for COVID-19 infections, especially in the first 3 to 4 months of the pandemic. So their fear of becoming infected, the protocols, the lack of personal protective equipment, medical students being put into the surge capacity, young, not yet graduates being put straight into at the forefront of the response, young nursing students being put into that response. So they're in a stressful environment. They're trying to manage that. They're trying to look after their own health at the same time. It's been described, and there's very good papers coming out of Canada earlier on in the pandemic. It's not just the wave of infections that we're going to face, that youth and women are going to face in the healthcare sector as well as in the population. They're going to face the wave of infections. They're going to face the wave of backlog, as other essential healthcare services are disrupted, postponed, cancelled. All that work has still got to be done by somebody at some point. Then they're going to be faced with the wave of the mental health challenges, the exhaustion, the stress, the burnout. So clearly, I said 70% of our health workforce are women. Increasingly large numbers of our workforce, as a share of the workforce, are youth, young professionals coming in. So clearly they are at the forefront of the COVID response. And I use the word forefront very deliberately. Many people talk about our health workers at the front line, but actually the forefront is where they are, at their leaders in our response. They are at the forefront, the leadership is there, rather than this purely being a frontline analogy of war and conflict. The leadership issue is key in terms of supporting and enabling them. Thank you.
Thank you for sharing that, Jim. There's clearly a ripple effect of consequences that we will be dealing with, unfortunately. We all definitely have our work cut out for us with this pandemic. The pandemic continues to be persistent. It continues to be challenging to all of us. It's a challenging health crisis. That's the biggest health crisis facing humanity, in my opinion. In our time, it has halted the entire global community dead in its tracks as it struggles to effectively respond and provide large-scale solutions to combat the harrowing effects of the pandemic. Now, Fatima. As the state of Qatar's development arm, Qatar Fund for Development has always been at the forefront of providing aid and solutions to some of the most pressing challenges and crises around the world. Can you tell us a little bit more about QFD's efforts in response to the COVID-19 pandemic and countering its socioeconomic effects on youth, particularly in war and crisis-affected areas?
Sure. Thank you, Benan. First, I hope you can hear me well, because I think I'm having a little bit difficulties with the connection, but I hope you can hear me well. Yes. As Dr. Campbell mentioned, with the coronavirus pandemic extending to over more than 182 countries and territories, the world is facing an unprecedented global health crisis, posing a significant disruption, of course, to communities, health systems, industries, economies across the globe. The most vulnerable groups are women and youth, unfortunately, and they are the ones who are bearing the brunt of the economic and social fallout of COVID-19, particularly in the war and crisis-affected areas. In the response to current global health crisis, Qatar Fund for Development has provided sizable interventions and rapid responses on behalf of the state of Qatar and its support to the international community. The provided aid aims to assist countries in mitigating and preventing further spread of the COVID-19. Qatar Fund for Development, along with its partners such as Qatar Charity, Qatar Red Crescent, Qatar Airways as well has successfully delivered aid to more than 82 countries around the world, which includes provision of medical supplies, PPEs, and food items. The donations made by the State of Qatar and several other participating countries and foundations will serve to facilitate, of course, the economic recovery for many of the countries who have been dependent on those who are more equipped to handle the current situation created by the pandemic. The collective contributions provided by the State of Qatar, represented by Qatar Fund for Development, and our local partners reached to 53.6 million US dollar. These responses are done in collaboration, of course, with our local partners. And here I would like to emphasize on the role of our embassies and so many countries over the world, and especially our embassy in Guangzhou in China, who facilitate the purchasing of the medical aid shipments from China to be delivered to Qatar. We also cannot ignore the role of the Ministry of Public Health in Qatar, who played a very critical role in, providing specifications for all the goods and the items and check them, and to make sure that at the top quality standards. In addition, of course, to Qatar Airways and also Emiri Air Force, who make sure the medical aid shipments are being delivered to the countries. Furthermore, QFD is working and partnering with regional offices of the World Health Organizations, such as AFRO and IMRO. We work with them to strengthen the creation and dissemination of evidence-based priority health interventions, including health emergencies for COVID-19. We also in QFD continuously exploring how innovation and technology can support development outcomes and business models by adopting leading global practices and fostering innovation, solutions, and provision of services. A good and a great example of this is of this cooperation approach is the UNDP Accelerator Labs, which is jointly launched by the State of Qatar and Germany, and it's co-funded by QFD with an amount of 20 million US dollar. This project came up with innovation solutions to tackle the negative consequences of the COVID-19, and we have a lot of labs already ongoing and operating in so many different countries, such as in Argentina and Iraq and Sudan. Thank you, Banan.
Thank you, Fatma. Thank you for sharing that. That was very informative. I know we're all working around the clock on this and trying to find the solutions that we can offer. It feels like we realize the magnitude of this global challenge, and we've been working relentlessly with our partners from diverse sectors. We understand that, this isn't a one-man job. It requires collective action. It requires all of us to come together to find the necessary solutions. And we understand that in the healthcare industry, as we've just mentioned, there will be a large demand for a skilled workforce, one that will only be fed by ensuring that youth and women are ready for this, are ready to be placed into these jobs. So Jim, can you tell us a little bit about WHO's concerns and the key issues that you think need to be brought to the forefront of the global agenda in relation to creating more jobs in the health sector?
Thank you, Banan and Fatima. Great to hear such excellent work and initiatives going on, supported by the Qatar Fund for Development, by Socioeconomic, by your partners. Indeed, we are all in this together, and our Director General continues to promote the message around global solidarity, that the world needs to work together to overcome this pandemic. We've just finished this week the resumed 73rd World Health Assembly, and obviously all virtual this year for the first. So our governing board, after in its 73rd year, coming together through the use of technology rather than in person. But COVID-19, the pandemic, the impact upon this, the issue of health preparedness, of health security, clearly dominating our discussions. as we look at the challenges, but also as we look at the solutions. And if you look at some of this, I mean, a lot of this evidence and this data has been available for many years, as we had previous global outbreaks, whether that was Ebola, whether that was SARS, whether that was the Middle East respiratory syndrome. People have been concerned around the underinvestment in public health, the underinvestment in preparedness, the underinvestment in education and employment. And we had several years ago, as we discussed around the ambition of the Sustainable Development Goals till 2030, a high-level commission on health, employment and economic growth, where WHO, through the evidence and the data that we collected and working with a commission of economists, of Nobel Prize laureates and many others, with the ILO, with the Organization for Economic Cooperation and Development, put out the evidence which said, you know, we're going to be faced with a global challenge in the next 15 years, which is that demand for healthcare is rising, accelerating all around the world. Demand for global health security is a must, and we must invest in that. And that universal health, the ambition of universal health coverage is going to add yet further demand on a limited number of human capital, of our labor, of our workforce, and therefore we need to invest in jobs. Jobs for, as we talked earlier, jobs for youth and women. And it's been wonderful to see Socioeconomic join in that partnership with the WHO, with the ILO, with the OECD, to try and drive investment in jobs, as you have a target of 5 million jobs in Socioeconomic. So we're saying the world needs to create nearly 18 million jobs in health and care, at minimum, to respond to the population needs. That's a minimum. That's not yet going into further activities. High income countries are still recruiting. And so the Assembly this week, after 10 months of the pandemic, we've seen, the challenges. Healthcare systems have really come up against it, no matter where they are in the world. We've heard some good examples, but there's many examples where it's health workers managing the pandemic, surge deployment, infections, deaths, and we're very concerned about the number of deaths amongst health and care workers worldwide. Then they're faced with the burnout, the stress, then this backlog of healthcare services, and now the potential in 2021 for a vaccine that may be available. The ambition is, at least 2 billion doses to be delivered in 2021. And yet the health workforce is the same. We haven't suddenly recruited more people to the healthcare systems, and yet we're giving them even further work. And so our concern clearly is that as we get a vaccine available, how do we maintain essential healthcare services? And how do we make sure the population, young women accessing healthcare services, young boys and men accessing healthcare services, how do they still get the care that should be provided? And how do the young health workers and female health workers provide that to them? It's going to be a major challenge. I saw the International Council of Nurses describing this on Friday last week as the equivalent to landing on the moon. It is that big and that large a challenge that the world is facing. And if you look at the 2 billion doses, where are they? It's mainly in low and middle income countries, where, that's where the population are. If we're talking about 20% of the population, that's where they are, in greater numbers. And that's where there are not enough healthcare workers to currently provide primary healthcare, public health services, let alone the ambition of universal health coverage. So the burden, the additional work burden of the COVID-19 vaccine is likely to disrupt further healthcare services and put yet more stress on the thing. So we need to respond. I think the key message that we're saying with member states, with the discussion here in Geneva last week, the key message, we must invest. Any economic measure, any stimulus measure that is put forward on the table to recover our socioeconomic development has to invest in health. Her Royal Highness Princess Muna Al Hussein from Jordan gave a keynote delivery, and that was her challenge to every single country in the world, to every single health minister, to invest in health and invest in the people, the health workers. And that means investing in jobs for youth and women. That's the key message.
Absolutely. Thank you. Thank you so much for that. That brings me to my next question, also to you, Jim. As you've mentioned, organizations like Socioeconomic, Qatar Fund for Development, WHO, ILO, OECD, we're all working to try and drive these investments, these necessary investments. But can you tell us what more we can possibly do in order to garner global interest, bring people together around this cause to meet this demand, particularly in less developed countries and areas of conflict, like you mentioned? They're already dealing with so many other challenges, like large fiscal stimulus gaps that they'll be facing, lack of social protection schemes, and insufficient economic and social policies that would aid their socioeconomic recovery and invigoration. So what can we do to help out? What more can we bring to the table? How can we bring people together around these investments and making the case for the investments that are necessary?
Indeed, I think if anything, the pandemic has really brought this message home to the leadership around the world. We knew beforehand, again, this is not new intelligence that we're suddenly faced, but it's the intelligence that we look at with a different lens. Nearly 2 billion of the world's population are youth under the age of 24. And nearly 90% of that population are in low and middle income countries. And as they graduate through their education systems and come into the labor market, we need to find decent work for them. We need to create jobs in the economy and to give them hope, to give them aspiration, to give them economic livelihoods for both the men and women. And particularly in the healthcare sector, when we also see that decent work is such a key agenda, and where the majority of our workforce are women, we have to put in place these economic opportunities. At the same time, as I described earlier, the pandemic has told us that we are short. We don't have enough capacity. And so creating additional opportunity in the health and care economy gives opportunity for this youth bulge, this youth demographic that's coming into the labor market. It's a human capital lens. We saw Jim Kim from the World Bank, the former president, really driving the message about human capital. We've seen the International Monetary Fund also talking about the need to invest in the social capital, health, education, and care economy, so that we drive that. So we've got two of the biggest lenders in the world in terms of international financing institutions carrying some of the messages. The African Development Bank, the Islamic Development Bank are saying the same. How do we create youth economic opportunities for youth to respond to this growing demographic bulge? So most of the international financing institutions also saying the same language. And then it's for partners like the Qatar Fund, it's like for partners in your many engagement, for Socioeconomic and your patron as well, who has the opportunity to communicate with presidents and prime ministers around the world. Your patron, who we admire for her work on this decent work agenda. How can you communicate the urgency of these messages? Investing in the healthcare workers, investing in jobs in health economy is going to give us global health security. It's going to give us greater improvements on gender equality. It's going to tick the boxes on youth employment. And it's going to create a very prosperous, virtuous cycle of human capital development and achieve universal health coverage. It is the potential best investment in today's global economy in terms of the SDGs. So how do we carry those messages further forward? WHO, our normative role brings the evidence, but it's not from that evidence we need the political will, the commitment to action. And that's what our Director General has been talking about since his appointment, that we need to invest. It's a political decision to invest in health. The World Bank has put $18 billion on the table for the COVID-19 recovery efforts, preparedness and response. If we put that investment into new jobs, the world would be a better place.
Absolutely. Thank you. Now, another challenge that we found is that, with the rapid spread of COVID-19 around the world in such a short period of time, it has made it very challenging for development organizations and other stakeholders to kind of provide thoroughly vetted, evaluated, and assessed responses. Responses need to be just as quick as the spread of the pandemic itself to combat the socioeconomic effects and other effects of the pandemic. Fatma, can you tell us how QFFD has been able to assess the type of response and projects that are necessary at this time? How do you evaluate the efficacy of the provided aid of your projects? And how do you capture the lessons learned that would help guide the way forward in facing this pandemic and other similar situations that hopefully we will never have to face?
Sure, Benan, thank you. In QFFD, we believe that for interventions to last and to be sustainable, they should enclave in a strong base and predictive intelligence. And that should be supported by appropriate financing modalities. COVID-19 has opened up an expansive bank of potential source of data and information with multidimensional variables that interact with each other in a manner that can amplify their impact on the world order. This calls for integrated coordination of development actors to explore innovative ways of utilizing this opportunity to collect, analyze, and to convert this rich information into usable evidence to gain new insights that inform decisions and provide clarity and strengthen future policy responses. A strong evidence base strengthens our preparedness is to evaluate the current state, identify gaps and resources needed, develop strategic acting plans to rectify and identify gaps, weaknesses, and priorities of interventions, also costing the budget allocation and execute our interventions. QFD and its partners are continuously engaged in different humanitarian projects to serve different countries based on the specific needs of populations and with a special consideration to those who are considered the most vulnerable groups, as mentioned before, the children, women, youth, elderly people, and others. Moreover, through regular donor cluster groups meetings, we have given the opportunity for key areas of pandemic-caused issues with existing projects. We have been able to discuss with each other, the success and the failures. This has meant a faster and more coordinated response and change in funding or adjustment of the scope of work of the existing projects. All of that to ensure the most vulnerable in our community are still receiving the needed support. For your second part, for the second part of your question, Banan, regarding how we capture lesson learned in QFFD, we usually in QFFD follow a process to collect, share, and disseminate lessons learned, and that are integrated in 5 main key steps. We can identify these steps into defining project, collecting information, verifying applicability, storage, and dissemination. Is critical across development actors and donors' activities in line with their unique comparative advantage to help identify responses needed in the field. We also highlight on understanding the key difficulties in the field is to construct sustainable and long-term solutions to current issues in the field. For example, in education sector, and as I mentioned earlier, the most vulnerable groups are children who could no longer, for example, attend school. It was identified that psychosocial support was needed as a priority within our projects to counteract the effect of the pandemic and to ensure that education was still a priority and to decrease the level of the out of school. This was understood as a result of collaboration across providers where feedback was heard from the field. QFFD responded by ensuring activities such as psychosocial support, teacher stipends were embedded into existing projects and were taken as themes in new projects to counteract the impact of the pandemic on children, education itself, and secure education as a priority during and beyond the pandemic. This is key in order to ensure a healthy, educated society and prevent the cycle of poverty impacting with the current and the future communities amongst the poorest and most vulnerable people. Thank you, Bana.
Thank you. Thank you both for sharing your insights. They've been extremely invaluable. We have a few minutes left and we'll be taking Q&A. But before we move on to any questions that we may have, I have one final question to the both of you. Can you just quickly give us your key policy recommendations for the global community to address the challenges that health workers face in light of the COVID-19 pandemic, particularly in less developed countries and areas of conflict? Fatma, we can start with you.
Yes, sure, Banan. I can frame my answer and, highlight the main three points, which are the need for collaborative approach. Resilience building is key important element as well, to keep local communities on board and to have new partnerships. And if you allow me, I can elaborate a little bit on each of them. So for the need of collaborated approach, COVID-19 is a prime example of how interconnected and interdependent our world has become. We cannot work alone with this pandemic. The pandemic is not only testing our health system, it is also testing our ability to respond urgently and with the requested solidarity across borders and boundaries. It is now more than ever that scaling up of international support and collaborated approach is needed to ensure access to essential services and social protection for all, especially the most vulnerable groups, women and youth. For example, here in QFFD, I can give an example of a good partnership with Gavi, and especially with the Gavi Advanced Market Program, COVAX, which guarantees fair and equitable access for developing countries. This is in addition to KFD's contribution to Global Fund, Global Financing Facility, and WHO, and etc. I don't know if I still have some time to elaborate more on the other points, or I can give the floor to you. It's fine?
Go ahead. We're good on time.
Thank you. The second point, which is resilient and sufficient healthcare capacity. Strengthening health, education, and economic system during COVID-19 and beyond is crucial for everyone. The pandemic has clearly exposed the vulnerability of the health system and economies. Having affected almost all humanity, COVID-19 has exposed the vulnerabilities of our health system and the fragility of our economies and highlighting the importance of building a stronger and more resilient health system and the need for better disaster preparation. We need to acknowledge the importance of investing in mitigation and adaptation and resilience building in least developed countries and conflict-affected states to ensure that they are more resilient to future shocks and able to recover in a faster and sustainable manner. The third point, which is the new partnership, and here I can just briefly explain what we mean by that. As you know, that there is great potential in engaging multi-stakeholders partnership among governments, civil society, donor, the private sector, and other actors for more effective response, not only COVID-19, but also to address our other challenges and issues. Partnership with the private sector, for instance, can leverage private capital, expertise, innovation, and business, for instance, can leverage business to benefit sustainable development. Qatar Fund for Development is currently actively exploring new partnerships with private cooperation through which we aim to support the achievement of the Sustainable Development Goals in LDC countries and conflict-affected states. The last point is the local communities integration. We should invest in training the health workers from the local communities to respond to COVID-19 and other challenges that may arise in future. The local community has the knowledge and the understanding of the problem and know which problems are most pressing, therefore putting them at the core of action, enhancing their skills, knowledge, and providing a platform for them to stimulate creative thinking and innovative ideas is the starting point to ensure that the local community assumes ownership of the initiatives that are built on their vision, unique challenges, and needs. Thank you so much, Banat.
Thank you, Fatima. Jim, over to you if you'd like to share your thoughts with us.
Thank you. I was just thinking of Fatma there and sort of nodding as she was making some of her points in terms of the key elements. I think the world is learning very rapidly from the COVID-19 pandemic, and we've seen an acceleration in the utilization of digital technology and digital exchange and brokering knowledge to inform those responses. So it's good to see that there's also some similarity in terms of the solutions. I think clearly we're seeing a need for global solidarity on this response, but national action. And that national action has to be engaged with societies, with communities. It's not going to be sufficient to have just political leaders determining the response to the pandemic. It's got to be owned and engaged by all the relevant stakeholders to take part in that role. Health prevention, health promotion needs to be still a core element of our response. Social distancing, sanitation, washing of hands, the messaging that we've had since January needs to continue to be part of that response. And so communities and populations, families have a key role to play in that national response to go with the global action. That global solidarity, I think we need the political leadership to really influence our future investments. And the world is watching. I think if you look at populations around the world, they're starting to hold political leadership to account in terms of their performance and their decision making in this response. And so any political leader at this moment in time is going to be looking about that accountability and think, okay, well, what's my response? The response has got to be to invest in our social infrastructure, our health services, our education services, social capital, our human capital for the future. We have to invest in these jobs for all communities who've lost their livelihoods, as some businesses and have collapsed around the world. So how do you reinvest in those jobs which are going to be in demand for the future? And health and social care is in demand today, and it will be in demand for the future. And how do we therefore invest in the workforce that's going to be responsive to that? And so that thing, and again, your patron, Banan, Sheikha bin Moza on her work here, I think she has a role to communicate, educate, and facilitate along with other leaders to steer some of those conversations. But then as you also evaluate and learn from your work in Qatar, from your work with Socioeconomic, what works in these communities? What works? What are the messages to make sure that that political will, the investment comes into local action that can really drive solutions which are appropriate to those responses? And it's going to be different. You mentioned earlier about conflict scenarios and emergency settings. Those responses are going to be slightly different than in low and middle income countries, which have got a stable governance environment and we're not necessarily having humanitarian challenges or conflict challenges. So how do you turn your knowledge of the local context, working with communities, into local solutions to come through? That's going to be the response we need. Global solidarity from the evidence, from our tools, political will, money, local solution to come through. And we're seeing already some good examples of this. We're seeing those local responses and the impact that they can have. We just need to get more of them.
Yes, absolutely. Great. Thank you. Thank you both for sharing your insights. We're a bit short on time, so we'll take only one question from the audience, and I will address it to the both of you. Um, what can young people do? We've talked about what organizations can do. What can young people do? How can they participate in finding the solutions? How can they help? So if you can very quickly just tell us how we can bring them into this process and help them become a part of it, part of the solution. Jim, over to you.
Indeed. So, I mean, there are a number of mechanisms. As I said, the youth are a growing percentage of the workforce around the world. We have a youth hub which engages the professional associations, the graduates, the students, and many others in healthcare. Reach out, get involved, organize, create local coalitions. Whether you're a professional, whether you're a statistician, a demographer, an activist, an advocate, get involved at your local level, represent your voice, get involved in the regional and the global levels where you can. This is your future. You need your voices to be at the table with solutions to come forward. We're aware of that voice and ready to respond.
Thank you. Fatma, any thoughts on that question? What can young people do? How can they be brought into this? We are unable to hear you.
Sorry. Yes, Benan.
Yes,
If I heard you correctly, you were asking about the role of the youth and counter or to combat the pandemic, because the voice was cutting off a little bit.
we're talking about how they can help, how we can kind of engage them in the process of finding solutions, how they can be involved in this process that we're all working on as organizations, as government.
My answer would be very simple. Like, we know the strong role of the youth in the world. We represent the majority of the population, and we believe that they can do massive work and they can do amazing work. So our faith is highly is up to the sky and the role of the youth. So we don't have any doubt on their role at all.
Yes, absolutely. Jim and Fatma, thank you once again for joining us today. It has been an absolute pleasure, and I've thoroughly enjoyed our discussion. At Socioeconomic, we're delighted to be undergoing ongoing discussions with partners and strategic allies to advance a common agenda. If there's ever a silver lining to COVID-19, it's that it has brought the global community around a common goal, with youth and women being at the center of it. It has never been more important to ensure that youth are empowered, skilled, placed into meaningful jobs within the healthcare sector and other essential sectors that will be needed in the future. I believe that if we can accomplish that, it's those young people that will lead us to a brighter future post-COVID-19. And personally, I look forward to seeing what that future will look like. Thank you for joining us today at the World Innovation Summit for Health. And we wish you and everyone else a great evening ahead. If you have any final thoughts to share, please do before we go.
Thank you so much, Benan. Thank you, Doctor.
Thank you, Fatma. Thank you, Benan. And thank you, Socioeconomic, Qatar Fund for Development. We look forward to continued collaboration. Thank you
so much.
Invest in women.
Thank you.
Thank you so much. Thank you so much.
Goodbye.
Bye.